So the last chapter in Unit 4 is going to look at some disorders in immunity. And so if we begin Chapter 16, just a couple of quick vocabulary words for us to define. The first one being immunopathology. So obviously logi is the study of, patho, the root word for disease. And then we think about immuno, obviously referring to the immune system. So it's the study of diseases associated with the immune system and its immune response. And so these issues that you have with the immune system, it could be underactivity where it's not doing its job, not working very well, or overactivity where it's actually an exaggerated response. And so what you'll see underneath this are some different kind of categories that are a part of immunopathology. So we start with allergy, also can typically be associated with the word hypersensitivity, because what an allergy is it's an exaggerated, kind of misdirected expression of an immune response to an allergen. And we're going to look very closely at this one in Chapter 16, because allergy is probably, of all the things in Chapter 16, the one that you're going to see most prominently in the medical field. We also, in this chapter, will look at some autoimmunity. So where, we've talked about before, the goal of your immune system is that it kind of establishes self versus non-self. And it does not attack self, but it does attack non-self. Well, in an autoimmune disease, you have an abnormal response to self cells. So instead of allowing the self cells to continue about their business, you attack those. It also looks a little bit at immunodeficiency, so loss of immunity or deficiency in the immune response, and then a little bit about cancer, cause and effect as far as immune dysfunction is concerned. And so a big thing that we look at in this chapter, like I said, are allergies, because that's going to be the most common part of this chapter that you're going to see. And so if you look at this image, and this is found on the bottom of page 503, so it kind of gives you a brief overview of the 4 types of allergens. So you have type 1, type 2, type 3, and all of those are going to be associated with B cells. Okay, and then you kind of move into type 4, which is going to be associated with your T cells. Okay, and so kind of a difference between those. And so what we're going to do in just a moment is kind of work through these 4 types. And so one of the objectives says kind of factors that are involved in allergies or factors that are involved in hypersensitivities, and just a couple quick things that I would list here. First off, you want to make sure you know what an allergy is, and we kind of already mentioned that it's an over-exaggerated response. And so basically it's an exaggerated immune response, typically associated with inflammatory symptoms to some type of allergen. And so that word allergy typically used interchangeably with hypersensitivity, because if you think about hyper, it means oversensitive or over-exaggerated. And these over-exaggerations are in response to allergens. Now, definition of an allergen, you want to make sure that you get this. It's an antigen. Right? So this is anything that can trigger an immune response. It's an antigen that's not necessarily noticeable to affect others. Okay, so allergens are basically specific to each person, because we know that some people suffer from certain allergies, other people do not. Some people don't have allergy problems at all, and so definitely specific to an individual. And then again, there are 4 types of allergies that we see. And so just to kind of give a quick rundown of these, so a quick outline. So type 1, these are your immediate allergies, and basically all of what we're going to talk about in this first section, this part A of 16, are going to be the type 1 immediate allergies, typically regulated by IgE, and we mentioned this in the last chapter. IgE is associated with parasitic worms and allergies. It involves mast cells, some basophils, because remember basophils are the ones that secrete those chemicals like heparin and histamine, and then allergic mediators as well. Examples of immediate allergies that we're going to see: anaphylaxis, hay fever, asthma, those types of things. So then you move into type 2. So type 2 is what we call the antibody-mediated incompatibilities. And so this is typically associated with IgG and IgM. And the big example I can give you with this one is blood group incompatibility. And so in part B of this, we're going to really focus on blood groups and understand the relationship there as far as transfusions and things like that are concerned. Type 3, allergies are what we're going to call immune complex diseases, and so this is where a lot of time we see some of those autoimmune diseases pop in. So they talk about like lupus, rheumatoid arthritis, rheumatoid fever, serum sickness, those types of things. And then type 4 are specifically the T cell mediated hypersensitivities. So we'll look at some of these a little bit later on, but we'll look at like graft tissue rejection, contact dermatitis, a little bit of autoimmunity kind of mixed in. And again, kind of the commonalities that we see here is type 1, 2, and 3 typically associated with B cells, and then type 4, those associated with T cells. So again, we're going to focus on type 1 for this part of Chapter 16's lecture. And so again, coming back to type 1. So type 1, what do these allergies have in common? Well, they have similar physiological mechanism. They are typically immediate on onset. So when you're exposed to that allergen, you typically immediately will start to see signs and symptoms, and they're typically antigen specific. So we see two levels of severity. So we see what we call atopy, or atopy, however you want to say atopy, and then anaphylaxis. So if we look at atopy, couple things to associate with it. So chronic, meaning it could obviously last for prolonged times of your life, but it's a local allergy. And so when we look at this severity, so it's typically not life-threatening, and because it's localized, it's usually easier to treat. Okay, so you think about like hay fever, you think about asthma, those are things that typically are localized, don't affect other parts of your body, so again, typically easier to deal with. The more severe level is anaphylaxis. And so with this one, it's a systemic response, so more than just one area of your body, it can affect large regions of your body, large different systems entirely. It's often explosive, and it typically involves airway obstruction. So anaphylaxis is typically what's going to cause that throat to start to close, circulatory collapse, and in some cases becomes fatal. So kind of your two severities there. And so a couple things that we want to look at with type 1. So if you look at objective number 5, factors that affect the onset of allergies. So basically things that make you susceptible to these types of allergies. So one of the things that we know is genetics, right? So most people that have allergies have a predisposition to allergies. For example, like if you've got parents that have an allergy, typically their children are going to be more susceptible to allergies. But what I need you to understand is that the specific allergy is not necessarily something that's inherited. So like an example that the book gives you is if the parent's allergic to ragweed, that doesn't necessarily mean that the children are going to be allergic to ragweed, but because the parent had an allergy, it's going to be very common that the child have one as well. It's just maybe to a different specific allergy. So where the parent may be allergic to ragweed, child might be allergic to cat hair. But again, the predisposition for having an allergy is something that is typically inherited. We also know that some other factors that affect the onset of allergies is the age, other infections that may trigger this, or geographic area. We know there's certain parts of the world where certain allergies are common. Like for example, think about where we live, a lot of farming goes on, and so it's very common around here to see peanut allergies, hay fever, things associated with seasonal bloomings in an area. And then the other thing that we want to know about allergies is they can be lifelong, but allergies are also something that you can kind of outgrow, or something that you can kind of develop into. So although they can last your entire life, in a lot of cases they're only for a small amount of time, whether you outgrow it or you grow into it. So a big part of objective number 5 has to do with portals of entries for allergens, because again, these type 1 allergies, these are what we very commonly see in the medical field. We commonly see these on a day-to-day basis, and so we want to look at some of these major portals of entry. So our first group we're going to look at, and this is actually found in your textbook. So if you look at table 16.2, this is on page 505, it may be easier than writing all this stuff down if you just want to print a copy of that table, but basically, so portals of entry. So first portal of entry, these are going to be those allergens, they're considered to be type 1, they're going to be inhalants. So obviously these are things that are going to enter through your nasal cavity. So we think of things that are going to be found circulating in the air, right? So pollen, dust, mold spores, dander from animals, animal hair, even insect parts, or strong chemicals like formalin and other types of aerosols, because we know that those can cause allergic reactions with asthma and things like that. So all of those would be under that category of inhalants. Portal of entry would be nasal cavity. But we also see ingestants. So these are type 1 allergens associated with the foods that you eat, right? So we think about there are quite a few people that are allergic to milk, right, to dairy. Peanuts, again, very common allergy we see. Wheat, fish, right? So shellfish, something you have to be really careful with. Other types of nuts besides peanuts, eggs, fruits. If you've had children, those are typically those things that doctors will kind of tell you to be careful of when you first, allow a child to eat those. You kind of have to watch them and make sure that it doesn't trigger an allergic reaction. There's food additives, and then of course a lot of antibiotics will trigger allergic responses, and so those things like penicillin would be considered ingestants as well. So then we have injectants, right? So these are going to be those that are injected into your system, and a lot of these are going to be under like the bug bite type deal, right? So venom from a bee sting or a wasp sting, insect bites, drugs/vaccines that are administered to you through injection, enzymes, hormones, again, administered through injection, we know can trigger an allergic response. And then the last category are contactants. So these are just basically things that you come in contact on the surface of your skin that can trigger an allergic reaction. So we look at topical drugs like creams, cosmetics, makeups, things like that can trigger allergic reactions. Heavy metals, detergent. There are some people who have to be really careful in what they wash their clothes in because it can trigger an allergic reaction. Formalin, rubber, solvents, and then even certain dyes can trigger those as well. So want to make sure that you know which portal of entry these allergens fall under, because again, these are some of the common things that you need to be aware of that can trigger allergic responses. And so one of the things that we want you to understand with an allergy is kind of the development of the allergy. And so on objective number 6, it mentions to you two terms that you need to make sure you know the difference between. So we have what's called a sensitizing dose and a provocative dose. And so starting with the first one, the sensitizing dose is the first contact an individual has with an allergen. So this is the first time you were exposed to peanuts, or the first time that you were exposed to that detergent. Typically, there are no signs or symptoms associated with an allergic response. See, the first time that you've ever been in contact with it, it basically is the first time your immune system has seen it, right? So it primes the immune system for the next encounter. And so if you look, there's actually a really good image of this in your textbook. So this is found on page 507. So basically what happens is here's the allergen, right? So this is whatever it is you're coming in contact with. Your body's going to take it in, whether you're ingesting it, contactant, inhalant, whatever. And so basically your T cells / mainly B cells are going to process these, and they're going to form antibodies. They're going to be present on cells in your body, basically just waiting to see if you're going to get exposed to that allergy again. So typically in the sensitizing dose, this is your body becoming sensitive, becoming, I guess you could say, immunocompetent to that particular type of allergen. And so this first exposure, you typically don't see those symptoms that are associated with an allergic response. So you don't see the watery eyes, the itchy eyes, that type of stuff. But the second vocabulary term they mention here is the provocative dose. And in the provocative dose, this is the second exposure to that allergen. And because your body is aware of it, it finds it out quicker. There's more of a rapid response to it, and so this precipitates into those first allergy symptoms. So this is where you may see vasodilation, you may see bronchoconstriction, and if you look at the image in your book, this is where you're going to see a lot of the running drainage, right? So you see the red itchy eyes, you may see hives on the surface of the skin, you may experience that runny nose drainage that kind of goes with that. So just understanding the difference between those two doses. And so then just a quick check for you with that. So they also mention some chemical mediators that cells can release. Now, there's not really an objective on this one, but I just want to kind of throw these at you because, again, if you work in healthcare, you're going to see these chemicals. You're going to talk about these chemicals like histamines and serotonin, leukotrienes, that type of stuff. And so there's a section in your textbook that talks about chemicals that your cells release, basically to account for those allergic symptoms. You think about, histamine and antihistamine, that type of stuff. And so what those chemicals typically target, bottom of the screen, are rashes, itches, sneezing, diarrhea, those types of things that are associated with it. And many looking at systemic targets as well. So good picture that's from your book, but again, there's not an objective on that, so we'll just kind of scoot through it. So objective number 7 says basically distinguish between disease associated with type 1, so atopic versus food, and then drug. And so just a couple quick things. So atopic diseases associated with type 1 allergies, hay fever, rhinitis, which is basically common cold. You can see a lot of seasonal symptoms associated with atopic disease, so things that we inhaled or came in contact with topically or ingested. And so with these atopic diseases, the way that we normally see this kind of show out in symptomatic form is either with like allergic asthma. So people with atopic disease for type 1 allergies a lot of times will have that bronchoconstriction, and so typically they'll have some type of bronchodilator, like some chemicals that they can take in their system, whether it be an inhaler or they go to the doctor for a bronchodilator to kind of open up that airway because it's gotten inflamed because of those allergens. Or then atopic dermatitis, we see a lot of people that they show their symptoms superficially, and so this can trigger eczema, the dry rash, they can be found on the surface of the skin. As far as food allergies are concerned with type 1, the most common things that we see symptomatically with that, vomiting or diarrhea, trying to get that food allergen out of your system. It can cause abdominal pain, or then it can also cause some more superficial stuff. So eczema, hives, we can see the cold with this, asthma with this. Occasionally you can see anaphylaxis with this, but typically food allergies, your body's going to try to get out of your system, and you're going to see the rash on the surface of the skin. Drug allergy, main things that we see with this one, some of the mild atopy, so mild asthma, mild dermatitis, but depending on the drug itself and how your body deals with it, it could lead to fatal anaphylaxis. So definitely things to be careful of with drugs. So just kind of a picture you can see of some of the hives on the surface of the skin. Okay, so then we come back to remember the two levels, so atopy, what we just talked about, but the other level, the more severe level of type 1 is anaphylaxis. And so with anaphylaxis, the key thing you see here is it's very acute, it's going to happen very rapid, and it's systemic, right? So we see itching, we see sneezing, but big things we see with this, difficulty breathing, convulsions, and even death. So two types of anaphylaxis that we see in humans. We see cutaneous anaphylaxis and we see systemic anaphylaxis. And so the cutaneous, obviously skin form of this, is you see the wheal and the flare, inflammatory reaction to a local injection of the allergy. And this is actually what you check for with the skin test. So this is that wheal and flare that you kind of see. But then the more common one that we associate with anaphylaxis is systemic anaphylactic shock. So this is that sudden respiratory and circulatory disruption. You can't breathe, you're not circulating like you're supposed to, and in a matter of minutes, this can prove to be very fatal. So most common allergens that trigger this would be like bee stings, the injection category, portal of entry, antibiotics, serum injection, that type of stuff. And so objection number 9 just simply looks at, diagnosing, treating, and preventing. So diagnosis either is done by skin test or blood test, depending on who you see as far as an allergy doctor is concerned. And then as far as treating / preventing, so, you would think the most common prevention would be to avoid the allergen. But depending on, so like ants, avoid ants, bees, avoid bees. But some of those allergens, depending on where you live, you may not be able to just necessarily avoid them. So some of the other things that we do is we can use drugs to actually block the action of your white blood cells and limit that allergic response, right? So we can take drugs and histamines to kind of block the histamine response, so to kind of clear up that drainage as far as that's concerned. Or something else that we do is desensitization. So basically we inject allergens into your system. It stimulates a high level of basically antibody production so that if you come in contact with it, you're able to deal with it quicker. So definitely some means that we look at there. And a quick check for you if you wanted to see that.